According to a new study, people who suffer from chronic pain prefer to take cannabis over prescription drugs. The study was jointly done by Tilray, a medical cannabis production and research company, along with UBC Okanagan. It tracked more than 250 patients who were prescribed medical cannabis to treat conditions like chronic pain, mental health, and gastrointestinal issues. Zach Walsh is an associate professor of psychology at UBC Okanagan who co-authored the study, and he's on the line with us this morning. Good morning, Professor Walsh.
Oh, good morning.
How did you conduct this study?
Well, the study was conducted through the patient base of Tilray. So they're the licensed producer of medical cannabis. And one thing that made this study a little bit different is whereas previous studies have asked people at dispensaries or asked through a variety of different ways to find out why people are using medical cannabis, this was exclusively people who have a doctor recommendation, a physician recommendation, which is necessary to be one of the customers of the licensed producer. So it was done from their customer list.
Okay, and what kinds of questions did you ask them?
Well, we asked them why they're using medical cannabis, if they get medical cannabis from other sources, how do they use it, and the real focus was, are they using it as a substitute for other substances? Because, if cannabis is just being used on top of other things, if it's just stacking on top of what other people are using, it may have some benefits if it's adding to their symptom relief, but really the benefits are going to come if we see it being used instead of other substances that may have their own harms. Particularly, we're thinking about opioids right now, which is on top of everyone's mind, but other medications have negative side effects as well. So we're interested to see if they're using it instead of rather than in addition to. Your
assertion that these things may be more beneficial than other doctor-prescribed medications is based on what?
Well, each medication, each drug has its own risks and benefits. And when we see substances like opioids, for example, that, have certainly a good place in medicine, and I think it's worth noting now when people are so concerned about opiates, it's still the vast, vast majority of people who use them don't have trouble. But a sizable portion do. There's a significant withdrawal profile, and there's also the risk of fatal overdose. So in that sense, because we don't see receptors for cannabinoids, the active ingredient in cannabis, in the brainstem, in the part that's responsible for breathing, that cannabis doesn't carry that same high risk of fatality.
Now, the people who preferred medical cannabis over other medications, what did they base their preference on? I mean, what was their reason for preferring cannabis?
Well, they gave a few different reasons. One of the main ones was a better side effect profile. So they found in some cases that it was more effective for treating the main symptom. But the most common reason was better side effects, and those included less withdrawal. So I think that's a specific reference to the opioids. So, equally or better effective was what many people reported, also less withdrawal and better side effects.
Now, the Canadian Medical Association and College of Physicians and Surgeons have been skeptical about the benefits of marijuana, saying there isn't enough clinical data on it that hasn't been tested, and it's kind of like double-blind clinical trials. Mm-hmm. How should we weigh your results against the skepticism of the medical community?
Well, these are different. They're different types of evidence, and it's true that all the clinical trials have not been done. We certainly need more clinical trials, and unfortunately, it may be a bit of a wait because of the fact that cannabis is something that's in the public domain. As much as groups like Tilray certainly make a profit selling cannabis, the R&D that you'd see in the enthusiasm for a brand new drug that you can patent may not be there. So, as much as we'd like the clinical trials and they're forthcoming, they may not be coming as quickly as we'd like. In the meantime, we have a lot of people who are using cannabis for medical purposes. So as we await those clinical trials, and I certainly agree that we'd like to see them, we have to look for other forms of evidence. And certainly looking at large number of patients who are using medical cannabis under a physician's recommendation can start to add to the conversation and slowly build the evidence base.
Now, you are a supporter of the legalization of marijuana, and so you're sort of an advocate. And then we have the study done with Tilray patients. Mm-hmm. Why should we trust this study as an impartial analysis rather than an advocacy analysis?
Yeah, well, first of all, I'm absolutely in favor of the legalization of cannabis, as are the majority of Canadian adults. But this paper doesn't speak to that. Cannabis for medical purposes is already legal. So this is just looking at why people are using cannabis for medical purposes, and it's gone through peer review. And I get my salary from UBC, so I'm an advocate for sound science and good public policy across the board. Medical cannabis isn't any different from the other common sense approaches I take to improving the human condition and the public health of Canadians. That and the peer review pretty much puts it on par with the other scientific literature. I mean, a huge amount of what we know about different drugs comes from research that's funded by interested parties like pharmaceutical companies. So I don't think this should be held to a different standard.
Zach, what questions does this research and its conclusions raise for you that you'd like to pursue further? I mean, what's the next step in this research?
Well, I think you touched on it when you talked about the clinical trials and the lack of evidence. What this does is it tells us that going forward, we should be looking at, how does cannabis stack up to things like opioids for pain relief? There haven't been side-by-side clinical trials, what we call comparative efficacy trials, in chronic pain. So we'd like to see those side-by-side comparative trials. Same goes for benzodiazepines, which is another class of drugs that people reported substituting cannabis for a whole bunch. And those are things like Valium, Ativan, sleeping pills, and anti-anxiety medications. So those are really widely prescribed medications that have their own side effects. If people are reporting that they prefer cannabis, and not a few people, but a large number of people, this isn't the first study to have findings like this, then I think we need to take the next step and do the hard science to see, hey, how is it working? Is it improving the health of Canadians without some of the side effects that we see with those other substances?
Professor Walsh, always good to talk to you. Thanks very much for joining us this morning.
Thanks so much for having me.
Bye-bye. Zach Walsh is an associate professor of psychology at UBC Okanagan. He co-authored the study. So what do you think? Cannabis as a replacement for other drugs? How do you approach this question? Give us a call, 1-888-662-6628, or you can reach us online, cbc.ca/daybreaksouth.